A very good afternoon to everybody. Welcome to this afternoon's webinar. It's a great pleasure to welcome you here. The webinar is a collaboration today between the Manchester North West Districts branch, the Yorkshire branch, Tees branch, Tyne Wear and Humber branches, basically the northwest of the UK and the northeast. It's entitled COVID-19, Mitigating the Effects your mental and physical well-being, and I've got two eminent speakers today. I'm delighted to be able to introduce Dr. Andrew Sharman, the IOSH President, and Louise Hosking, one of our Vice Presidents. So I'm going to hand over to Dr. Andrew Sharman, the President, and let you begin your session. Please, would you share your screen, Andrew?
Thanks, Chris. Great to be here. I am Dr. Andrew Sharman, President of IOSH. Thanks for your welcome today. It's great to be here and great to see so many people from so many different parts of the country, whether you're in Yorkshire, Tees, Tyne Wear, Manchester or Humber. Great to have you with us. As Chris indicated, I'm open to your questions or comments at the end of this session. If you want to use the Q&A function on the bottom of Zoom to do that, you can ask me a question about anything that I have to say with you here, or anything else that's on your mind. If you want to share any feedback with me on anything at all, or you've got a question that's not even connected with what I'm about to say, that's also fine. I'm your president and I'm here to serve you. So please let me know what's on your mind and what we as a presidential team need to be thinking of. I'm going to stay on this call for about 10-15 minutes and then bounce off to another call. And I just really wanted to address you all as your president with a note of support as we try to cope as well as we can through this unprecedented challenge as the pandemic continues. COVID-19, the coronavirus, has and still is continuing to disrupt our lives, isn't it? We've been isolating, distancing ourselves from family and friends, working in different ways, and not being able to engage or interact in the ways that we've been used to pre-COVID. Remember then? It's unsettling, isn't it? Some of you know that I've found myself in a bit of an unsettled situation. I normally live in Switzerland. I've been living here for 10 years now, but I'm originally from Scotland. And at the end of February, I went for just a quick trip back to visit family in Scotland and ended up staying there in an Airbnb rental apartment for 3 months, just with a weekend bag of clothes. That was really frustrating. I was missing sleeping in my own bed. I was missing not being able to see the people that I had gone to visit. And it was tough. And to make matters worse, I managed to contract the coronavirus too, and had several weeks of not feeling particularly well. Thankfully, I managed to get a flight and get back to Switzerland at the end of June. And it's been nice, as I say, to get back here and try to get back to a normal way of life. But what is normal? The lives that we were all living prior to February or March this year are kind of different to the lives that we're living now. I run a consulting business specializing in safety culture and safety leadership, and the way we run that business, the way we deliver our service, is completely different to the way it was at the start of this year. The way that our clients run their businesses are completely different to the way that they were running their businesses just at the start of the year. And I imagine that for every one of us, all 85 of us on this call today, things are different. I've kind of had enough of this pandemic, to be honest. I want to get back to normal or new normal or the brave new world, whatever it is. But I know that we need to be patient, which, as those of you who know me, will know that patience doesn't come easy to me. I like to get stuff done and make stuff happen. Despite all said, I think we need to remind ourselves of the positives that we can take away from this pandemic, such as getting to embrace the time we have to spend with those that we love, finding ways to strengthen connections with others. Through webinars like this, I'm finding myself on between 10 and 20 webinars like this every week at the moment, or through video chats on our mobile devices and computers too, through social media, through letters, through phone calls, through instant chat messaging. You know, during my 3 months on lockdown in Scotland, I found myself going back to basics, picking up a pen and a note card to write messages, handwrite messages, to people that I perhaps lost a bit of touch with, but I wanted to reach out and say hello. And I got a couple of handwritten notes back, and it's quite restorative. It makes us feel that the world is a good place and people really want to connect. All of that, of course, in the context of the constancy of news feeds on the pandemic, which are pretty much impossible to avoid, aren't they? The coronavirus dominates every newspaper, every news feed, every news report. But there needs to be a balance, doesn't there? Because I think we can get too much news. And one of the biggest risks from this pandemic is actually the infodemic that accompanies it. So over the last few months, I've been disciplining myself to really reduce the amount of news that I consume. And instead of looking at every news report and every article, I take my updates from the scientific institutions just once or twice a week. That's one of the ways that I've found to try to cope through all of this. And I guess we're all finding ways to cope. And what the pandemic means for us and what our role is, whether it's as a husband, wife, partner, brother, sister, father, mother, friend, colleague, co-worker, or whatever relationship we have with those around us. And that kind of takes me to another key learning that I've made through the pandemic. And that's the importance of human connection. Whilst governments around the world have told us we need to have social distance between people, I think that phrase is a misnomer. It's not social distance that's needed, it's physical distance. 1.5 or 2 meters, depending on where you are. 1.5 or 2 meters of physical distance between people to reduce the risk of spread of virus. Of course, it's only one of the control measures, but it's one that I think is poorly worded. Because social distance, I think, has reduced over these last few months. When the pandemic started, I became quite anxious about what the pandemic meant for me as the president of our great institution. And I worried that I wouldn't be able to get out and speak to people at branches around the world. It really kind of upset me for quite some time, and I didn't know what the solution was. But just a few days ago, a member of the presidential team said, "You'll be the president that met more members and spoke to more members than any other before." And I guess that's thanks to this social distance being reduced by technology like this Zoom platform that we're on today. So I wonder if you might like to think about what social distance and physical distance means to you, and particularly reflect on the human connections that you've been making over the last few months. You know, as your president, one thing that's really important to me is the work that you do. It's never been more important than now that the profession has an opportunity to come right to the fore in this pandemic. At the end of March, as the pandemic began, and again at the beginning of June, I recorded short video messages. You may have seen them, but they've been dubbed my co-videos, where I spoke about the amazing efforts of IOSH professionals around the world, including nearly 48,000 of us IOSH members in 130 countries now. Many of our members are either working from home with families and kids around, or from makeshift desks at our dining tables or sheds or spare rooms. And then there are those of us who are in different, displaced or unusual work environments. Regardless of where we are, we're all joining forces as one to ensure that we and our membership remain strong. So it's a real pride and honor for me to be your president, particularly in these turbulent times during the pandemic. If you haven't already seen those co-videos, you can watch a copy of the recordings of them on the IOSH Coronavirus Resources page. And feel free to share these videos in your own networks too. In both videos, I also spoke about the IOSH Benevolent Fund. Many of our members may be facing hardships during this challenging time, and that's where the Benevolent Fund could offer a lifeline of financial or other support to members who are struggling. I encourage you to take advantage of the fund if you find yourself in that situation, or if you know someone that might be able to use a little bit of extra help right now. To find out more, just visit iosh.com/benevolent fund. To show our support, every member of the IOSH presidential team has donated to this vital fund, and we would appreciate all other contributions too, no matter how small. Every pound can help one of our members. So if you're able to do so, please consider boosting this fund to help your fellow colleagues. donation is really quick and simple. Just 2 or 3 minutes using a credit or debit card online at iosh.com/how to donate. I've indicated to you that I've found the pandemic quite anxiety causing. And I reckon that most of us will be feeling somewhat anxious by the changes that we're experiencing over the last few months and as we think about the future too. So to address this, I'll soon be handing over to Louise Hosking, one of our vice presidents, who will present a session on how our mental and physical well-being can be affected in these difficult times and how to mitigate those effects. Our members are critical to a safe and healthy recovery from times of crisis and occupational risk like this. It's important our membership is supported, and the presidential team are proud of the efforts dedicated to doing this. So far, we've taken the presentation that Louise will share with you to nearly 2,000 members across our networks and still have a number of branch events scheduled for the forthcoming weeks. So far, poll results have shown us that over 65% of our members say that they felt an element of stress due to the current situation, which evidences that we do need to talk about our physical and mental well-being. I really hope that you find the presentation useful and each of you take something away from it today. During these difficult times, it's important to remember that the little things we do can often make the biggest difference. The way we look out for one another, our loved ones, our friends and neighbours, recognising and thanking those that are working throughout the pandemic, whether it's the key workers, those on the front line, or your colleagues at work. A quick phone call, a letter, a card, a video call, even a thumbs up and a smile, whatever we can do to stay connected. You know, we're all on this journey together, and as one IOSH, we will succeed this virus. Each week, I'm sharing my personal journey in my LinkedIn posts that I'm calling The Life of the IOSH President. And each week, we've got thousands of people coming together in that point to share the discussion, to add comments, to raise questions. And I encourage you to get involved in the discussions there if you'd like. In a few moments when I've finished, I'll post a link to that LinkedIn space on the chat box on this webinar. Please feel free to connect with me and come and join in the chat. Of course, IOSH will continue to keep you updated and support you through this challenging period. Keep an eye on the IOSH website, in particular the COVID page, where there's a stack of resources updated on an almost daily basis. And don't forget about those weekly webinars that we run every Thursday too, with thought leaders, scientists and experts from around the world sharing the very latest thinking, not just on what the pandemic looks like and how it's progressing, but how to return to work safely too. As I said earlier, right now is the moment that our profession can really shine. Our profession has never been more needed and never been more important in my view. I think now is the time that we'll look back on in years to come and say, that's when things changed. That's when we were really recognized. That's when we were really valued as IOSH practitioners. I'm looking forward to that time in the future. But for now, thank you for your time and your attention. And I wish you and your loved ones the very best. Take care of yourselves. And don't forget, please, to make some time for yourself and your own well-being too. Be well, stay safe. Thank you.
Thank you, Andrew. I've got a couple of questions for you, if you've got time just to pick on a few. It's part of a reminder, but I've turned it round into a question, and that is, how important is it to vote in the council elections?
Yeah, this is my friend Kieran Delaney, who sits on IOSH Council. Thanks, Kieran, for that reminder, and thanks for being here on this session with us. Look, it's simple. You hear politicians and communities saying whenever there's election, come on, you've got to get in and vote. But I'm asking you, in fact, no, I'm pleading with you now, please, IOSH members, step up and use your voice. Each of us as members have the right to elect who we want to see leading our institution. Council is the voice of members. It's the conduit between members at large and the chair of council. And sometimes people don't realize the president is just one role. There's chairman of council too. So I have two hats that I need to wear. And the chair of council is the collector of the membership's voice that's then used to feed and shape interactions and interventions with the senior leadership team at IOSH, Bev Messenger as our CEO and her staff, and with the board, Dr. Bill Gunyon and his team on the board of trustees. So the only way we can get members' voices to our chief exec and chairman of the board is through council. And the only way to do that is to make sure that we've got good, robust councillors who want to be that conduit for members. And I know it's challenging. This year we've had more council nominations than ever before. 56 people want to join council. That's fantastic. So please just take a couple of minutes, whether it's with a cold beer or a glass of wine at the end of the day, or a cup of coffee, or tomorrow morning before you start your day. Please just take a few minutes to look at those election statements and decide who you think, in your own mind, would represent your voice and the voice of the IOSH practitioners that you know the best, and go ahead and cast your vote. I'd love this year if we could find that we get more than just a fraction of the membership voting in elections. It's absolutely important, and it's entirely in your hands.
Thank you, Andrew. I think you've covered off the other questions, and I've helped in that, but thank you very much for that. I would be delighted if you would introduce your fellow Vice President instead of me, because I think you do more justice to me, so I'll hand you back to you, Andrew. Thanks,
Chris. Well, that's on the spot. I don't have a script for introducing Louise, so I'll make this pretty simple.
I think you know me well enough by now, Andrew.
Louise is part of our PT9, as we call it, the Presidential Team 9. So you know within the Presidential Team, there's President, there's immediate past President, that's Vincent Ho, and there's President-elect, Jimmy Quinn. And then we have 6 Vice Presidents who help the Presidential Team 3 discharge our responsibilities and support us in lots of activities too. Louise is one of our Vice Presidents, and it's a delight to be able to introduce her now as she presents this session on mental and physical well-being during times of the pandemic. So Louise, hopefully that's enough to get you smiling and to make sure you've got your screen ready to share now.
That's great. Thanks, Andrew. And thank you to everybody for inviting us to this session. Okay, I'm going to share my screen and hopefully not share all of my emails at the same time, which I have done so far. Okay, right. So just to give you a little bit of background in terms of this session, this is something that has been prepared and designed by the presidential team, and we really wanted to raise the awareness of the importance of mental health and looking after our mental health and well-being at this time of the COVID-19 pandemic. And its goal was really to provide our members with some basic information to enable you to protect both yourself and your families during this very difficult time. We're hoping that by the end of this session, you'll be able to describe the negative spiral of psychosocial issues and when to reach out to a psychological or a social counsellor for support. So we're going to run through a few topics. We're going to look at the stages of prevention. We're going to look at the variables that determine stress, the risks as they have presented themselves in respect of COVID-19. We're going to look at the negative spiral of multiple psychosocial issues and breaking the causation. And at the end of the session, we're going to introduce you to an information sheet, which we hope members will find useful and be able to take out to their organisations to use going forward. So we're going to start with a poll, and Andrew in his introduction actually mentioned that we've been running this presentation now across a wide range of branches, and we're collecting this information as we go. So just to start off the poll, I'm going to ask Dimple to bring that up. It's a simple question. At the moment, are you feeling anxious or stressed during this current situation? So I'm just going to give everybody some time to respond to that poll. So how are you feeling right now? Do you feel stressed or not? Okay, so I think that's probably broadly in line with what we're seeing in other sessions, but certainly the majority of people right now are feeling very, are feeling anxious, clearly under pressure. And I think, you know, if I look at myself and what I'm doing at the moment, you know, there's a lot going on. We're under a lot of pressure to support organisations in respect of the current climate, and there are a lot of changes. So that's not a surprising result, and we are collating those figures. So going on to look at the science between around public health, we're really sort of bringing this down, because I think I remember talking to a psychologist around this a couple of years ago, and she said, you know something, it's like managing jelly. It's not something we can, you know, it's not tangible like safety. So how do we as IOSH professionals start to really focus down on this and think about how we can support others? So initially, the primary phase is we want to keep people healthy. We want to have controls and arrangements in place whereby people are kept healthy, so they're working or being in a safe place. Then our secondary measure is if people are starting to show signs of stress, tension, anxiety, you know, what can we do to mitigate that? You know, what are the early warning signs? How can we step in early? And finally, the tertiary stage, when people are actually ill, how are we going to provide support to those people? You know, where is the support that they can go to? Do they know where they can go to? In thinking about these three levels, our prime goal, therefore, is to stay healthy, and is, you know, prevention first, which really runs through everything that we do in IOSH and as IOSH professionals. Under the stresses of the current situation, our next goal is to mitigate the effects when we show indications of a problem. When things reach a point where mitigation strategies are not successful, then we all need to seek help. So there's quite a lot on this slide, but it's really thinking about those three different levels and taking them to a different place. So there's going to soon be a published IOSH mental health guide, which has been provided by Chartered Fellow Chris Sharman from his publication, Can We Talk About Mental Health? And we can provide you with links to that. What this image is showing is that merely putting in place reactive controls to measure and then respond to workers' mental ill health is not going to get to the crux of it's not a prevention first. So we really need to look at those preventative controls that we should have in place throughout organisations. And this really comes back to how do we maintain a healthy workforce and healthy workers. So such controls can be identified by measuring potential mental ill health stressors in the workplace and working through a risk assessment process. So we're going to be looking for those key hazards. Where are those key points that we need to put mitigation controls in place? All controls then should be implemented after this stage. And then we still need to look at how we deal with those individuals that are needing some additional support and starting to demonstrate that they may have mental ill health. And some prime examples of reactive controls are going to be around worker employee assistance programs and mental health first aid. But really what this diagram is saying is look for the hazards within your organisation, talk to your people, have those conversations, and start to think about how your organisation is actually structured to produce so that you're working in a safe environment from a mental health perspective. So I'm sure that everybody here is fully aware of the IOSH's 6 key pillars, and you can see that mental health and well-being is one of those key pillars, and I'd actually go so far as to talk about the rehabilitation or return to work, particularly at the moment in respect of the position that we're in right now. I think when we were going into the pandemic in the UK, you know, there was a lot of uncertainty. People, you know, were thrown into situations that they weren't aware of, didn't understand. And there was a lot of stress and anxiety that was going, you know, certainly I think we all felt it at that time. And then we've kind of reached this sort of plateau of kind of new normal, as we're all calling it. But as we start to respond and build back again, we're not going back to the same workplaces. So that peak in mental health is going back up, and we're certainly seeing people are feeling more anxious about going back. They don't know, you know, what am I going back to? How will my work look? You know, how am I going to be? So I would also tie it in with rehabilitation as another key area. So a prominent researcher in the area of stress at work is a gentleman called Robert Karasak from the University of Massachusetts. And he created the Karasak model, which demonstrates that mental stress can be measured via 3 different variables. And this is all tied in with, you know, everybody is different. When we talk about risk assessments, we talk about, you know, who's going to be at risk, and different people perceive and react to stress in a different way. But this is really bringing it down to sort of 3 core areas. So it's an individual's perception of demand, and that could be high demand. You know, if you think about yourselves and how you're feeling, for example, at the moment, I think a lot of IOSH professionals, you know, we're used to things changing when there's a legislative change, saying, right, how are we going to deal with this? But we're seeing changes constantly every week, and certainly organisations are relying on us in a way that they haven't before. So for lots of us, there's very high demand, but equally, you know, we're all in the same storm, but we're not in the same boat. And equally, there are people with very low demand. So we know there are people that have lost their jobs through this, or they've been furloughed for long periods of time, and which is part of the reason why Andrew talked about the benevolent fund, you know, and it's a time when we need to be supportive of both sides. So the next part is an individual's perception of control. So when we feel in control of something, when we feel like we fit in, then our anxiety levels can reduce. But right now, you know, that control, you know, back in March in the UK was to a certain extent taken away from us. So the government was deciding on how we would work and how we would be. And certainly with the differences in the demands, the amount of control that we've had to hand over control. So that can, you know, but again, is down to individual perceptions. And finally, the last one of those phases is around social support. And a lot of us are, you know, certainly when I went into becoming an IOSH professional, it was so that I could be out and about and meeting people. And I think we are people. That's what we do. We work within teams, but we've all been forced to work from home. We've been, you know, we're doing our work and performing our duties in a different way. But then again, there's others that are having to go to work in highly stressful situations. So you can see how this is kind of relaying and how the virus translates into, you know, these perceptions and how it's affecting us all. But the isolation can translate into a lack of social support. And alongside stress, of course, other factors can also have a negative impact on our mental and physical well-being, such as poor nutrition, lack of exercise, injuries from accidents, and sleep deprivation. And I'm going to come on and talk about that in more detail a bit later on. So I think we all recognise this, we all look at risk assessment, and certainly those of you that have been involved in carrying out risk assessments to support organisations at the moment, this is a virulent, nasty disease, where certain, you know, parts of the people that are already vulnerable we know it affects different people in different ways, but it's a nasty disease, and we know the outcome for many has and will be fatal. So as we're doing those risk assessments, are the consequences are going to be high? The risks are high. It's difficult to bring the risks down to an acceptable level. And that's really going to tie in with the fears around, that's going to encourage this whole piece of anxiety, particularly as we go back to work. It's going to encourage stress. So in 2001, this marked the ILO's entry into the area of stress at work. And in its flagship programme Solve, the ILO described a model by which stress could trigger one or more negative outcomes, or any or all of the negative outcomes could trigger stress, leading to this negative spiral or a negative synergistic effect. For example, the stress associated with COVID-19 generated, as mentioned before, through high demand, lack of control and lack of social support, may put an individual into a frame of mind that precipitates a lack of sleep, substance abuse, which could in turn lead to psychological or physical violence. And we know from hearing news reports that there's certainly been families that have been brought together, or individuals in situations where we know that violent acts and aggression have increased. And thinking about those individuals that, some of us have been working from home, some of us, some individuals are on the front line every day. And certainly some of the aggression that has been shown in certain situations, is going to lead to increase all of that as well. So thinking about all of those things, you can see that it's just where we are is kind of a melting pot for all of these people sitting behind the desk all day, inadequate exercise, financial insecurity. We don't know what's going to happen next week or the week after, and we're seeing good businesses struggle. So it's not surprising that we're entering this kind of vicious cycle. So thinking about possible outcomes, I'm going to ask Dimple in a moment to run a second poll. What I'd like you to do is think about all of these different outcomes. So we've got stress, so it is that feeling of not being able to cope, mental, you feel that your mental health is being affected. Do you feel that you've had, you're moving into a situation where you're not getting enough exercise, you're not moving around? Are you finding that you're resorting to addictive behaviours? It could be overwork. You could be, just doing. Social insecurity, so being away from people that support you. Financial insecurity, perhaps you're not sleeping, you're not eating in the right way, or you feel that you're having to, you're coping with some violence as well, or bullying or aggression in some kind of way. So I'm going to ask Dimple to bring up the second poll. I'm going to bring up those points again. So what I'd like you to do is just say, in your current situation, how many of these outcomes do you feel you are personally experiencing? And I'm just going to let that run for a little while. Okay, so this is, I'd like to be in the 6% that are experiencing none. And again, I think this is fairly consistent with certainly the sessions that I've taken in respect of where we are. I actually think it's probably improving, but we're collating all of these results from all of these sessions. But yeah, there are, there's a good, there's a sizable percentage where we've got 3, 4 or more of these situations. So, it kind of pulls out that this session is important. So thank you for that. Okay, so a recent communication from the World Health Organization suggested certainly that constant news reports about the current situation can definitely lead to feelings of anxiety and stress. And I think certainly when we first went into this, you know, it's difficult for us, isn't it? Because we've got to keep up to date with everything to support the organisations that we're working alongside. But they're definitely, you know, Andrew talked about a video pandemic, you know, we can certainly have too much information and it can overload us, and that can definitely be a source of stress. So looking then at the role of the IOSH professional, you know, I agree with everything that Andrew said. I certainly think that people are looking at health and the way that we support in a completely different way. Personally, when we went into this pandemic, I didn't know what it was going to mean for me personally as an IOSH professional, but the people that I've worked with have been highly supportive and grateful for the work that we've done in a way that I've never seen before. So it just shows that, you know, that there is a very real place for us, and we need to be helping to organisations to assess risks, to provide communication and engagement with workers, and to collaborate with colleagues and other authorities as well. So we've created this kind of framework, if you like, to help IOSH professionals to start to focus on how we can support organisations in this area. And occupational safety has got to be up there. So it's important for workers to feel safe whilst they are at work. Thinking about ill health, people, you know, good work is good for everybody. So thinking about issues that can cause occupational disease, physical injury, you know, disabilities, how does that come into the mix? And remembering that mental health can be influenced from, you know, people bring their personal lives and what's going on outside of their work life into work as well. And it's the management of mental ill health must be focused on workplace, you know, we focus on workplace causes, but good organisations and good managers will always offer support and signpost for those that are suffering from mental ill health caused by domestic or personal affairs as well. Because it's in the interest of any organisation to address mental ill health as holistically as they possibly can. And then we've got the pieces around general health promotion. So although you can't force somebody to get involved with all of these things, it's just encouraging people to engage with healthy lifestyles, creating an environment of work-life balance, giving people advice on nutrition, physical activity, and just helping with, you know, bring people together, particularly at this time. So looking after ourselves, right at the beginning of this pandemic, when, you know, as Chris I think mentioned, is I'm also chair of a branch myself, and I was really keen that we maintained that branch connection to support members, because we could, you know, you could almost feel what was going to happen. And we connected quite early on with our colleagues in Asia to say, well, you know, how have you guys, you know, they were ahead of the curve. And he's recently stepped down, but Darren Brenton was chair of IOSH Singapore. And I loved the way that he talked about this and said, you know, when you get on an aeroplane and they give the emergency announcements and they talk about, you know, the oxygen masks, they always say, put your oxygen mask on before helping others. And I think it's really important that we stay strong and stay connected to each other. And that's what we can do as IOSH members, because we need to be strong. We need to look at our own mental health in this way so that we can be truly effective for the organisations that we support. I guess this is also about thinking about you. Because let's face it, we're not in the easiest of jobs at the best of times. So it's really thinking about what are the things that you can be doing to support yourself. When is it that you need to reach out to somebody else, perhaps? And finally, we've created this information guide, which is available for everybody. And it basically says, reach out if you feel that you need to talk to somebody. I've seen an enormous amount of community created across the networks over this time. Within larger organisations, you'll probably have an employee assistance programme. And it's to use those tools if they're there for you and you feel that you need to. If you don't have access to one of those, then there's lots of free support, such as the Samaritans. We've got a talk at Chiltern this week from Mates in Mind, looking at men's mental health. But it's just, seeking out support and talking to each other. And I know that there are members that are on this call today who are always there at the other end of the telephone. And as a group, we can do that, and we need to support each other so that we can support others. And just a few more links there to supportive and hopefully helpful resources that you can access. But thank you. This is a very short toolbox talk, hopefully to get people thinking. And all of the slides and resources from this are available so that you can go out and you can use it within the organisations wherever you are. And with that, I'm going to stop sharing my screen. So are there any questions?
There are some questions, Louise, and just bear with me. Syed made a point, and I think it's something worth just exploring, that anxiety and the stress are in fact two different things, two different definitions. And he wanted to just ask you if you could explore that a little bit.
Yeah, I mean, I think anxiety is that kind of feeling that we have. Stress is, we know as IOSH professionals, when pressure gets to a certain level, it creates stress, and anxiety is kind of a piece of that within it. So you can feel stressed but not necessarily feel anxious, I guess, is what he's saying. So stress has, there's lots of symptoms that are behind that. But yeah.
Thank you. Anne Lovell made a comment, and Kieran jumped in between, so you have to bear with me on this. But Anne's asking, is there guidance for addressing the mental health effects on spousal and family, spouses and family, especially for those people who work from home, meaning that consideration should be taken to the fact that rather than the point noted by Louise of taking the personal stress into work, home workers have actually taken the stress into their home. So there's clearly a potential effect on the family life.
Yeah, I mean, so this is, out of all of this, that, out of everything that's happening at the moment, we don't really know the true effects yet, which I don't believe. And I think, we're all feeling like we're working differently to how we're comfortable. My work colleague at work is now my husband, who's working in another part of my house. And that, that starts to create a different levels of anxiety, because you don't, my husband does not want to talk about the ins and outs of Riddle for some reason. And so, when I want to talk about those things, there isn't anybody there, and that kind of leads to that social piece kind of being missing. I would go back to reaching out to, colleagues and talking. Something I will promote, actually I've got it on my desk here, is this is the HSE's Talking Toolkit. So if you go onto the HSE website and just search for Talking Toolkit, this will come out, and there's actually going to be a version 2 of this, I've been reliably informed, that's going to come out shortly, and it is around those 3 key pieces, so control, isolation, demands, and it encourages line managers to actually have a conversation with people, and I think in terms of what we do, we like to have process and certainty, and we can't have process and certainty around this. So we've got to talk to each other and have difficult, sometimes, conversations potentially. But if you're not quite sure how to have those conversations, I would say have a look at this, and it's free on the HSE website. It's a really good publication. So I don't know if I've answered that question completely. But I think it's about having conversations and being honest with each other.
That actually links in nicely to a question that Kieran's put on, and he said, also people's mental health can be impacted by what others say to them. Anecdotal evidence has stated that words can do more harm to a person's well-being than actually being physically injured.
Yeah, no, I always talk about this, is that, so as Kieran knows, that, you know, I'm a big advocate for inclusion, equality and diversity. And we know that when people are excluded or, you know, treated in a disrespectful manner, that can have the same, you know, scientists have shown that it has the same impact as physical pain on the brain. So, you know, the way that we react to each other and the way that we communicate with each other is hugely important. And, you know, I mentioned in the presentation, a lot of this is around personal perceptions. But I think we all need to be, we need to take a step back. We all need to be a little bit kinder to each other right now and give each other a bit more space to do what we've got to do, because we probably won't be as effective as we normally are in normal circumstances. But yeah, you're absolutely right, Kieran.
I suppose from my perspective, I see working from home in some circumstances is quite challenging, because people get involved with things at work, they get stressed, they get frustrated, and they get annoyed. And at work there are control measures for that. There's offices to go and sit in. There are colleagues to temper and control your output. But in the home environment, it would be easier to let go. No, I would imagine.
Yeah, and I think the other thing that's happening to us all at the moment as well is that you know, we're living and working in the same environment, so those kind of boundaries that we had are breaking down. So, you know, I'm never very good at keeping work and life boundaries, but you know, I get up every morning at the same time, I get dressed for work, I, you know, try and follow the same kind of routines as I used to. But you can't get the same kind of social interaction as you can on Zoom, as you can when you're out with people. And I guess it's about us as individuals reaching out. And Kieran's always great at reaching out to individuals as well.
I would say one of the benefits of the branch network and the online calls that both of us have been having with our respective branches, and that is that community, that network, that release, that benchmarking, that arm of comfort has been in some ways been replaced by working online. And I would compel any members who have not engaged with their local branches to make contact and actually, you know, bolt into that network, especially if they're struggling or if they need some support. I know I've got a team, and I'm sure you have, of committee members that would be delighted to help support people in difficult times. So.
Yeah, I mean, do you know, I've just been so impressed with networks. I mean, everybody, all of, you know, there's probably lots of, you know, volunteers on this call at the moment. You guys have blown it out of the park over this time, and you know, there have been people that I know who don't normally go to branch sessions where they've said, do you know what, I'm feeling a bit up and down, and that's okay. And I just say to him, you know, just look down the list at what's going on. As I said, in Chiltern on Wednesday, we've got a men's mental health session. It's, you know, turn up. If you feel like you just want to listen and not have the video on, that's fine. If you want to be engaged, there are people and other members there that can support you, and you know, just use the tools that we can access at the moment, because nobody is on their own. And you know, I'm seeing connections within IOSH that I've never seen before, and we can't, that's a positive that's come out of all of this, because you know, I don't think we'll ever lose that now.
No, the new normal.
Yeah.
Just one final question. I asked it to Andrew, and Kieran was very good at prompting this one, but why is it important to vote for council?
It's, do you know, I'm massively committed to getting council working as effectively as we can get council working. Council is the voice of the membership. When council is acting effectively and working smartly, the advice and guidance that comes out of council goes into the board and can potentially change the direction of health and safety. Because, you know, remember that there are lots of organisations and institutions that represent IOSH professionals, but IOSH is the biggest. So that influence is not to be underestimated. And, you know, Chris, we were talking about some of the negativity that we hear around, well, we're not doing this, we're not doing that. You know, my perspective on all of this is, if you don't think it's right, get involved with the process. And use your vote. But council is enormously important. And certainly, you know, the presidential, and I think, you know, I share that with the rest of the presidential team, the more effective council is, the more that we can do for the members.
Thank you for that. Well, we've come to the end of the session. On behalf of the Northwest region, Louise, you're always welcome up here, you know that.
Thank you. I am also really looking forward to seeing people back in person again. So
absolutely. I discovered the other day that somebody actually had legs. So instead of just seeing the top half of them. But on behalf of the branches in the Northwest and the Northeast, and have jointly put this session together today, thank you very much. And thank you to the 90-odd participants who've joined us today. And on that basis, I'm going to bring the session to a close. Thanks, Louise.
Thanks, guys. Thanks. Bye.